Hello, I am Dr. Mirela Cherneyanu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. This podcast episode, I'm going to shift gears a little bit, but continue the topic of wellness exams. And I'm going to talk about young men and young boys. Young boys first and then young men in their 20s. What to watch for between the ages of 15 and 20 and 20 to 30 as far as a health check for young men. And I would like to start exactly where I left off in the last episode. And again, that was discussing our teenagers' health. What are the best things to look for when your doctor performs a physical wellness check on a teenage girl? And this episode will start by talking about young boys, and then I'll move on to young men in their 20s. So some of the same principles for health apply for the wellness check of teenage boys, which are 15 to 20. And those would be identical as for young women. For example, the number one marker for wellness, which is body composition, should be top of the list. And that is because, unfortunately, according to the NIH, National Institute for Health, among adolescents ages 12 to 19, more than 1 in 5, which is over 21%, have obesity. This is a very high and concerning number, as adolescents, teenagers with higher BMIs and more comorbidities, which is associated problems, are much more likely to experience a decreased health-related quality of life overall. The most common comorbidities for obesity in teenagers are high blood pressure, high cholesterol, diabetes, osteoarthritis and joint pain, sleep apnea, and breathing problems. Imagine the quality of life that an obese teenage boy with hypertension, high cholesterol, diabetes, sleep apnea, and joint pain will have as he turns into an adult. And imagine how starting his life with such a health burden will impact his lifespan and his longevity. More so, adolescents with obesity may also experience psychological effects related to their body composition and excess weight and their overall appearance, which may include low self-esteem, depression, anxiety, eating disorders, and unfortunately, an increased risk of suicidal ideation. So, body composition, number one on my list. Next, blood pressure and heart rate are essential health markers, and they should be checked every time a medical visit is performed for any young teenage boys because they don't visit the doctor very often. And it's important to get those markers. Another top of the list health marker, and kind of like number 2 on my wellness checklist, is mental health. So top, body composition. Number 2, wellness, is mental health. Why? Well, because it's really, really, really important. And I know that's not the usual start of an exam. The doctor starts asking about history, does the physical exam, and then eventually eases into the mental health exam. But I put it so high on my list, and I'm talking about it early in the podcast episode because it is so important. Our medical community, as well as parents in general, should take a lifelong approach to the mental health for their children. Why? Because good mental health begins in infancy. Let me share some very scary statistics with you. 20% of teenagers may experience a mental health problem in any given year. 50% of mental health problems are established by age 14, and 75% of mental health problems by age 25. 10% of children and young people under 16 years of age have a clinically diagnosable mental problem. That's 1 out of 10. Yet, 70% of children and teenagers who experience mental health problems have not had appropriate interventions at a sufficiently early age. So even though the incidence of mental health issues is high, addressing these mental health issues by a provider is not happening. Mental health in young men is crucial, considering that 20% of all children and young people in the US have a mental, emotional, developmental, or behavioral disorder. That is 1 out of 5 young women and 1 out of 5 young men. So, mental health. The next item to check on the wellness list for a teenage boy, my number 3, is puberty check. Keep in mind the medical exam of the developing genital organs, especially the testicles and the penis, is very important. Lots of problems can pop up at this age. Inguinal hernias, a hydrocele, undescended testicles, and last but not least, testicular torsion could be very serious and it could affect a developing teenage boy randomly out of the blue. So warnings for signs of testicular torsion should be shared with the teenager and the parents. Also, as part of the puberty check, testosterone levels peak during puberty and when a young boy reaches adulthood. So what is the normal testosterone level for a young boy? Well, at age 14 to 16, likely anywhere between 200 and 400 would probably be okay depending on the developmental stage of his secondary sexual characteristics. But by the time the young man is over 16 all the way to 20, the testosterone level should increase and reach 800 to 1200 by late teens to early 20s. So keep in mind, if the young teenager is over 16 with testosterone levels under 600, that might signify a serious hormonal problem, and perhaps further hormonal studies are warranted, and consider a consultation with a pediatric endocrinologist. Number 4 on my wellness checklist for teenage boys is sexually transmitted checks. STIs, or sexually transmitted infections, used to be known as STDs, many people still call them STDs, are unfortunately among the most common public health problems worldwide, especially among adolescents and young adults. Teenagers and young adults in their 20s account for almost 50% of all STDs. The most common STD is chlamydia. The reported chlamydia rates are highest among teenagers and young adults. For example, in 2022, almost 60% of all cases of chlamydia were reported among people aged 15 to 24. As chlamydial infections are usually asymptomatic, screening for them is the best way to detect them. Why do we need to worry about chlamydia in teenage boys? Well, because number 1, if they have it, they're going to spread it. And number 2, because having multiple sexual partners is a common practice among young people and teenagers exploring their sexuality. And risky sexual behaviors, including early initiation of sexual intercourse, having multiple sexual partners, and condom non-use are very significant health challenges among teenagers, specifically due to their potentially negative effects on later sexual and reproductive health. So education in this area is crucial and probably needs to come from the doctor. There are very effective post-exposure prophylaxis measures available for protection from HIV, gonorrhea, chlamydia, and trichomonas. But there are no post-exposure regimens available for herpes. So please be aware, and education is crucial. I got 2 more on my wellness physical list for teenage boys. Dental health is number 5, and vision and hearing screening are number 6. Now, and not necessarily at the bottom of the list because it might come last, because it is very important. At the end, we should consider some best practice lab testing for young boys that are developing into young men. And that might include testing the kidney, the liver, the lipid profile, a complete blood count, fasting glucose, hemoglobin A1C, that's a glycosylated hemoglobin level, especially if the teen is overweight or obese, checking testosterone level, some basic thyroid labs, and obviously do not forget to ask for nutritional markers like vitamin B12, vitamin D, iron, etc. So to sum it up, the most important health markers you need to be aware of is number one, body composition, height and weight, blood pressure and heart rate checks. Number two, mental health assessment. Number three, puberty development and testosterone levels. Number four, safe sexual practices education and sexually transmitted disease screening. Number five, dental health. Number six, vision and hearing. And number seven, laboratory tests, blood and urine. So let me move on to young men, age 20 to 30. The young men in the United States are unfortunately in a little bit of a health crisis. And it's very unfortunate that this is happening, but this is reality. I have discussed and presented statistics and facts about the mental health of our teenagers. And obviously, this is spilling over into our young men in their 20s. And that should obviously be number one concern for anyone who has a teenager that is struggling with anxiety, depression, poor self-image, or gender identity issues. Many experts have been talking and warning us for quite a while now about the dangers of the toxins in our environment. Unfortunately, we have dug our own hole because in the quest for more technology and more convenience, we have fallen prey to many things that are not good for us. One of them is our diet. The young boys and girls and the young men and women, unfortunately, their diet, it's outside of your control as a parent in many circumstances throughout their daily lives. When they go to school, they hang out with friends, they eat in other people's homes during a sleepover, during parties, they're out with friends shopping at the mall, they go to the movies, etc. Addressing this issue, the dietary issue, needs to start early on when parenting a child. Someone's dietary habits are developed in childhood will stay with them for their entire life. Now, I don't know about you, but if you're a mature adult and you grew up in the 70s, 80s, and 90s, your parents most likely had a much more regimented approach and disciplinarian view on eating habits. You had to sit down with the family and you would only get up from the table when everybody was done. There was no TV or cell phones. Oh my God, imagine that. You would have had to eat all the food on your plate, which was not necessarily always a good thing. I'm not saying it's a bad thing either, but that would depend on the amount of the portion. And it would also depend on the composition of the food, the proteins, the vegetables, the carbs, the fat, the antioxidants, etc. There are some concerns that instilling the need to clean up your plate develops bad behavior, especially when that person is going to be exposed to large quantities of food delivered in a restaurant later in life. We all know portion control is key. And if you've ever gone to Cheesecake Factory or some other restaurants, they fill up your plate with inhumane levels of food and the portions are huge. You really have another meal on the same plate. Another issue is that the food we ate 20 to 30 years ago was very different than the food we eat now. And that is a reality. It's not just me talking about it, and I've talked about it months ago in previous podcast episodes, but more and more people are talking about it openly and criticizing the food industry. Everything that's made and sold and marketed around food, it's about how to make these foods more and more addictive. So it increases the profit margin for the company that make the product. That's also very true for restaurants. A restaurant cannot be profitable If the food served is not highly palatable, which means very tasty, very addictive, making you want to come back for more, making you remember that food experience as being highly rewarding and satisfying, which increases your desire for more of the same. So when you're ready to eat out again, you're going to say, I'm going to go to that place and choose that restaurant because it served that awesome food I loved that made me feel a certain way. Now, back to the dietary habits of the young generation. That has to start early on. And if it hasn't started early on, and if the young teenagers or young adults have bad habits around food, consider the fact that it will take a very long time to break these habits and develop new, healthier habits. So establishing and building good habits around food is a must if you want your young children, teenagers, and young people to be healthy. Now, apologies for making you take this little detour with me, but I feel very strongly about this because I think that our bad food and our bad food choices are making our children, our young men and women, and eventually our adults have dysfunctional hormones, dysfunctional digestive microbiomes, which would lead to poor immune system issues and mental health problems. So, top of the list during a wellness check for young men is obviously the same as the teenagers, mental health evaluation. It doesn't always mean providing them with a depression questionnaire right off the bat as soon as they enter your office. But everything is evaluated during the visit by a very smart and savvy provider. The demeanor, the ability to express themselves. And that's a problem nowadays. Everybody just texts. They forgot how to talk. Their mood. Do they seem optimistic? Do they respond to a joke? What is their attitude? Are they lighthearted or sad? Or they simply don't care and appear very indifferent, or they cannot take their eyes off their cell phone. So, before a wellness check gets in the nitty-gritty of how a young man feels physically, it should start with how a young man feels mentally and emotionally. If there are any issues identified, then delving a little deeper into their social history would be a very important thing to do. That is when the physician or provider actually takes the time to ask the young man or the young teenager's boy, that's also valid, asking the parents about exercise, dietary habits, what type of diet is he consuming, how much exercise is he getting, how much screen time is he getting. That might be a variable that might need to go on the health questionnaire because everyone carries a cell phone. And that cell phone indicates your average screen time and where you spend most of your time, which is very interesting. Now, I guarantee you very few physicians or mid-level providers spend a whole lot of time with questions in this area. However, this is very important. More questions your doctor should ask are some of the following. How much alcohol are you drinking? Are you drinking alcohol even if you shouldn't as a young man under 21? Are you smoking or vaping? How much? Are you doing any drugs or have you experimented with any drugs? Are you dating? Are you being sexually active and do you engage in safe sex practices like using a condom every time? Now, all these questions are highly invasive and very personal. It's almost like confessional at church, except you don't confess to the priest about all these things, right? However, the doctor wants to know because they are highly pertinent to a young man's health. However, they are embarrassing, they take a lot of time, and I guarantee you that very few people in the medical world that provide care to young men spend a lot of time on these questions. Very few people. So if your doctor does not ask, then you should share this information with them voluntarily. Or if they're not interested and they cut you off, change your doctor. Come see one of us at Hair Beauty and Wellness in Thousand Oaks. We take the time to review all this information and we think it is important. Hopefully, once this is done, after the mental health assessment, the social history questionnaire, the next most important thing, number 2 on my list, would obviously be an overall evaluation of the physical health of the young man, which would include a blood pressure, height, and weight measurement, and determining whether he is within a healthy BMI for his age. The BMI, the body mass index, is related to the body mass composition measurement. And this is a crucial health marker because it not only tells you the percentage of body fat and muscle mass, but it also tells you, depending on the machine that's used to assess the body composition, where the body fat is distributed, highlighting abdominal excess distribution of fat. Because when that is happening, which is sometimes very obvious clinically, you can just see the belly fat. You don't necessarily have to put someone on the machine to measure it. But that type of distribution, the belly fat, is critical to be discussed because abdominal and visceral fat is an indicator of poor health and is a very strong predictor of health risk for diabetes, heart disease, and metabolic syndrome. And those three things are killers. So after mental health, social history, physical markers, ideally, the doctor would do a detailed medical history, surgical history, family history. But then next, he or she would do a review of symptoms evaluation to identify if there are any subtle health concerns that could be further investigated. Now, what is a review of systems or a review of symptoms? Well, your doctor should ask about all of the following systems: overall wellness and constitutional symptoms like fatigue, insomnia, recent weight changes, night sweats, and such. Number 2, vision and hearing. Maybe some brief questions. Are you having any problems or changes in your eyesight? Do you wear glasses or contacts? Do you have hearing issues? Do you have tinnitus, ringing in your ears? Do you have ear pain, nasal congestion, sinus issues, frequent allergies, etc.? A lot of people do not pay attention and do not share with their physicians any of these symptoms. However, they are important. Number 3, cardiovascular. Number 4, lung health. Questions like, do you have chest pain or shortness of breath at rest or when you exercise? Do you have asthma? They're very important. Do you have palpitations, regular heartbeat? Do you feel like your heart skips a beat? All of these things are important. Number 5, digestive health issues. They're often overlooked, but much more frequent in women, but they could be worrisome in young men and signal some very serious issues. So that your doctor should ask about constipation, diarrhea, bloating, heartburn, etc. Number 6, urinary issues and genital health questions. Difficult urination, burning with urination, abnormal penile discharge, premature ejaculation, testicular pain, unusual testicular lumps, or any symptoms of penile irritation should be discussed here. Number 7, musculoskeletal issues like stiff and achy joints, achy muscles. Number 7, neurological symptoms like headaches, tingling, numbness, etc. Number 8, skin health is important. Acne and rashes are a sign of problem, so they need to be shared with your doctor. And last but not least, number 9, bruising, frequent infections, signal issues with blood and immune system health. So the key review of symptoms are eyes, ear, nose, and throat, cardiovascular, lungs, digestion, urinary and genital, musculoskeletal, skin, neurological, immune system, and of course, I've already discussed mental health earlier on. After the review of symptoms and review of systems is done, and all the data regarding the medical, surgical, family history is collected and entered in the medical record, then your doctor would follow with the physical exam. And after the physical exam, there should come a very important item on my wellness checklist, and that is testing. I love testing. And a big part of the testing should be 2 things that I'm going to talk about that are constantly ignored and overlooked by many doctors. And that would be a hormone evaluation, especially testosterone levels. And number 2, sperm analysis. Let me say a few words about each one of these. Number 1, healthy and optimal testosterone levels are crucial for normal male development. And if the young man is going to reach adulthood and be a confident, well-functioning male, then normal optimal testosterone levels would be a must. I don't want to spend a lot of time on this episode on the low testosterone epidemic. but it is a reality. Many people are talking about it. Even mass media and various channels are dedicating documentaries about how this is an issue. Low testosterone, known as low T, in young men can be due to many causes, but surprisingly, poor mitochondrial function might be at the top of the list. And there are many things that can take out our mitochondria, which is the engine of every cell in the body. For example, chronic infections like chronic mono, long haul COVID or Lyme, exposure to toxins like vaping, marijuana, alcohol, especially binging or use of other drugs, heavy metal exposure at work, in the home environment, exposure to mold toxicity from home environment, workplace, or classrooms. But last and not least, exposure to toxins from processed foods and beverages, and from our use of technology daily. When we travel in our car, we cook, we exercise at the gym with equipment, and the list could go on and on and on. Addressing mitochondrial dysfunction adequately and effectively can surprisingly restore and significantly improve testosterone levels in young men. So it should be something that needs to be considered. I'm going to stop here because I talked about this in previous episodes. So all you got to do is rewind and look for other episodes where I address this, but this is important. Number 2, again, this is a very unusual health marker that I want to mention and discuss in this podcast because almost all doctors that do wellness checks in young adults do not check this. It is not recommended, it is not taught, it is not discussed in any health educational forums, and because young men have to pay out of pocket, as health insurance companies do not cover it. This is sperm analysis. And yes, you heard me right. Your insurance company will not pay for it. Now, most men, young or older, have their sperm checked only when confronted with the issue of infertility. And the truth is that 50% of infertile couples experience some form of male health issue that unfortunately has been ongoing for many years and undetected because it was never checked as part of a wellness check. So I personally recommend that any young men somewhere between 21 and 30 should have a sperm analysis as part of their wellness exam. Now, maybe not every year, but every 2 to 3 years. Remember, healthy sperm is vital for the reproduction of our species and a very powerful indicator of a man's reproductive function. And again, I believe sperm analysis and testosterone levels should be a must check for all men under 30 on a regular basis. Again, maybe not every year, even though I would check testosterone every year, but the sperm analysis every 2 years, every 3 years minimum. That brings me to the end, and I'd like to close with the testing requirements for the wellness check and what the health markers for a young man 20 to 30 would be. So remember, the nutritional status is not always reflected in the height and the weight because the majority of obese, overweight, and overfed young men are unfortunately nutritionally depleted, which means their vitamins are inadequate. So I highly recommend testing for B12, vitamin D3 levels, iron levels, magnesium levels, calcium levels, maybe other B vitamin levels as well. All of these can be very indicative of the nutritional health of a young man. So to recap, I started with mental health, social history, blood pressure, height and weight, review of systems, physical exam, testosterone levels and sperm analysis, and ended with blood testing for vitamins. And not to discount the common, usual general health markers that everybody does. Kidney, liver, complete blood count to rule out anemia, markers for insulin resistance, especially if the young man is overweight, the vitamins, obviously, and last but not least, sexually transmitted infection screening from a urine test. Now, if you're a young man that wishes a comprehensive annual wellness check, To cover all the stuff I talked about, it might require 2 or 3 visits. It would take a lot of time to discuss and review everything, especially if you want the visit to be billed and reimbursed by your health insurance company. Now, if you decide to pay cash and not use insurance, then the doctor or mid-level provider might dedicate 1.5 hours to your wellness visit. But then you should expect to pay cash out of pocket, somewhere between $300 to $500 for a new patient evaluation, and probably half that if you're an established patient. Now, I hope that you found the discussion on the wellness checks for young men useful. If you know a young man that could benefit from this episode, please share it with him. Come back next week. I will talk about the wellness exam for the young developing women in their 20s and what they should expect, what level of care, what should be addressed and asked in the wellness check for women aged 20 to 30. I'll see you next week. Thank you so much for listening. If you are one of my faithful listeners and you are finding value and enjoying these episodes, please feel free to leave me a review on whatever platform you're listening to. Also, if you find the content in these topics useful, not just to you, but to someone else, a friend, a loved one, or simply an acquaintance that you know could benefit from the knowledge I share here, please feel free to forward my podcast to them. If you live in California and you'd like to work with our practice to help you achieve your wellness goals, please go to our website, www.herabeautyandwellness.com, and request an appointment. It will be our privilege to help you in any way, shape, and form we can. Any suggestions on a topic of beauty, wellness, or anti-aging are welcome. All you have to do is go to the website, leave a suggestion into the AI chat, and I promise you if you ask, I will listen and add your suggestion to my list of topics that I want to get to as soon as possible. Please join our Facebook group, The Wellness Optimizing Warrior MD. It's a small growing community that focuses on wellness, on what's new, what's safe, and what works in beauty, wellness, and anti-aging.